Hello, my name is Joe Spaniol, and I'm a third-year independent plastic surgery resident at Temple University Hospital. Thank you for allowing me to discuss with you today my study with Dr. Brian Bunowitz looking at 248 patients who underwent total capsulectomy and implant removal for breast implant illness. We have no financial disclosures. Breast implant illness is a syndrome involving a constellation of symptoms potentially driven by an immune response to breast implants. Awareness of BII has been fueled by the power of social media. Plastic surgery societies, as a response to this, have hosted BII panels and forums at recent meetings, often involving patients, their advocates, and surgeons. With IRB approval, we sought to better characterize the outcomes of BII patients who had presented to a single surgeon and underwent bilateral implant removal and total capsulectomies. The study population consisted of 248 patients who underwent surgery between August of 2016 and February of this year. The average patient age at presentation was 44. Most had implants placed previously for cosmetic purposes and were non-smokers. On physical exam, 55% of patients exhibited Baker 2 capsular contracture, and 43% exhibited Baker 3 or 4 capsular contracture. Symptoms mentioned at the time of initial evaluation included generalized pain, fatigue, cognitive fogginess, migraines, and many others. The number of complaints did not vary significantly between types of implants. 60% of all implants removed were saline and 40% were silicone. 85% of all implants removed were smooth and 15% were textured. The breakdown of different makes and models is shown here. All capsules had been submitted to permanent pathology to assess for acute or chronic inflammation, which was defined as calcification, histiocytic reaction, presence of macrophages, sclerosis, lymphocytic infiltrate, or the term inflammation in the pathology report with reference to the capsule. Here we see that capsules associated with silicone implants were significantly more likely to contain inflammation than capsules associated with saline implants. This figure illustrates that capsules associated with textured implants were significantly more likely to have inflammation compared to those with smooth implants. The results of logistic regression modeling are illustrated here. Textured is more than twice as likely to be associated with capsular inflammation than smooth, and silicone is more than twice as commonly associated with inflammation than saline. Cultures were sent from all implant pockets at the time of surgery. These were found to be positive 3 to 4% of the time. 6 major complications occurred, which consisted of 1 pneumothorax, 3 breast hematomas, and 2 DVTs. Minor complications consisted of 5 seromas and 3 infections. Our follow-up ranged from 2 to 6 months. Almost all patients reported a decrease in the number of symptoms, and 92% were pleased with the surgery. Limitations of our study include that it is retrospective, it relies on a self-identifying diagnosis, there is no control group, and we had a relatively short follow-up. We also do not have any objective systemic inflammatory markers to report on, and we did not use any validated patient-reported outcomes measures to quantify patient satisfaction. That said, we found that evidence of capsular inflammation was common among patients presenting with complaints ascribed to BII, and that this inflammation was significantly more commonly associated with silicone or textured implants compared to saline or smooth. Though most of the implants removed were saline in this study, the silicone elastomer shell of saline implants has been implicated as a possible culprit in BII and warrants further study. Our study is consistent with others that have found that for women with BII, removal of the implants and capsules significantly reduces symptoms. In conclusion, we believe that total capsulectomy and implant removal in patients with BII can be safely performed with a low complication rate and a satisfactory outcome. Thank you so much for your time today.